flexible furlough scheme, which kind of raises a bit of a question. In the event that there is a second spike in the virus involving some more lockdown measures, will you undertake to switch the furlough scheme back on, or once it's over, is it just over?
Thanks, Ed. I think, after your first question about difficulty, I'd say, look, many businesses already have been facing an enormous amount of difficulty. Many people have already been facing an enormous amount of difficulty. And you asked about unemployment. Despite this extraordinary and significant intervention that we've put in place, I can't and we can't protect every single job and every single business. I have aimed and tried to make the scheme as generous as possible in terms of its duration, its flexibility, the contributions we're asking, to try and protect as many of those jobs as possible. And indeed, people like the Office of Budget Responsibility or Bank of England, or indeed I think today the Institute for Government, have talked about the fact that the scheme has achieved that aim and will mean that we are in a better place than we otherwise would have been. But I agree with you, there will be hardship ahead for many, and that rests heavily on my shoulders. I'm very conscious of that, and we are working very hard, and I will work very hard to make sure that all of those who do lose their jobs as a result of what's happening, that I'm working as hard as I can to get them back into work and good work as quickly as possible. With regard to the scheme, as I said, this scheme, as it stands in a national way, in the way that it's designed, will end in October. But if you look around the world at how long people have put these in place for, I think that compares very favourably. 8 months, as I said, is, I think, a generous and long period of time and allows companies across the UK to slowly ramp back up and gives them the best possible support that it can to do that. Steve, anything? I don't think there were no other questions. Ed, do you want to anything else follow up on?
I mean, sorry, since I have a chance, I
of course.
will. But because you talked about planning for the recovery, and as part of that, you might well need extra tax measures and stimulus measures to try to get the economy going. You talked about kickstarting the economy. Can you just give any sense as to what that might comprise, and in what form at least might we hear about it? Is there going to be an emergency budget, perhaps?
When I'm always asked about these things, you'll forgive me for giving the same answer to all of them, Ed, which I can't and won't talk about future budgets today. But in terms of the format or timing of that, of something like that, rather than the content, what I had said previously is that I was planning to have an autumn budget to get us back onto a cycle of autumn budgets. As you well know, we release the timing of events like that in the normal course of business, and that's exactly what we would do. Brilliant. Thank you, Ed. Next, Andy Bell from Channel 5. Andy, hello.
Yes, hello. Thank you very much. For the Chancellor, Chancellor, the government's always said it's following the science on its dealings with the coronavirus crisis, but Downing Street this morning confirmed that the alert level remains at 4. The Prime Minister had said he was hoping it was going to go down to 3, but it remains at 4, we're told today. And under the government's own definition of these levels, it's only at 3 that you can have the gradual relaxation of restrictions, but we're going ahead with the relaxation of restrictions, certainly in England. Does that mean we're no longer following the science? We're prepared to take decisions based on other factors? And Dr. Powis, how worried are you that we're just being a little bit too risky about how we're going forward with relaxing these restrictions?
Andy, in terms of moving forward, what we've always said is we've set out the 5 tests very clearly, and because we are now meeting the 5 tests, because of the heroic efforts of everyone at home, the NHS, everyone, we're in a position to carefully and deliberately start to release the restrictions. I wouldn't say that that's happening in a reckless or big bang way. As the Prime Minister set out, it's being done in quite a measured and phased way, progressively, to make sure that we can keep an eye on things and we're not running before we should. So, my view is we've set the tests out. We are meeting the test, and therefore we're in a position to do these moves. They are progressive and measured moves. We constantly are keeping an eye on everything, and I think Steve would probably echo that there's been no change in the dialogue or the relationship we have or the advice we receive. We remain very cognizant of the scientific advice, very engaged in it, and listening to it very strongly.
Yes, well, as you know, the important thing is to keep the transmission rate, that R rate below 1, because that means that the number of infections is declining over time rather than increasing. And of course, we all want to ensure that remains the case, and the scientific advice to the government will be how that can be done through a range of different measures or approaches. But I think it's really important going forward because we still do have infections in the community, 7,000 or 8,000 according to the Office for National Statistics, as I said earlier. It's really important that we monitor infection rates in the community very, very closely. And if there is any hint or any sign that the infection rates are going back up, that the R rate is going above 1, that action is taken to ensure that R goes below 1 again. And that will be the scientific advice, and I'm sure the government would also want to take account of that advice as well in keeping R below 1 so that we can avoid any second peak or any second increase in the virus.
Andy?
Yeah, can I just come back on
of
that?
Course.
I mean,
yeah.
It just sounds like, the Prime Minister was clearly hoping we would be able to say we've gone from 4 to 3. We haven't done that, and yet we've pressed ahead anyway. It does rather look like the decision had been taken, and whatever with the advice coming, we've pressed ahead regardless.
No, I'm not sure that's right. I mean, when we've made these decisions, we've always done them in conjunction with the latest scientific advice, and Steve and his colleagues are completely aware of everything we're doing. I think the other thing that Steve touched on, which I think is important and certainly has been important in the conversations I've had with Sir Patrick or Chris Whitty, are around our ability to now keep an eye on things, which because of the test, track and trace system, because of our new surveillance operation and the information we're gathering, that's something that has changed from where we were previously. We now have stood up, I think, in a very impressive effort, and I pay tribute to all the people involved in it, this ability to really track what is happening, measure what is happening across the country, and react quickly if need be in a more targeted fashion. And I know that's something that all of the scientists were keen for us to put in place, and helps give them confidence that we can move forward in this way, but we will be able to spot problems and react quickly and in a targeted fashion should the need arise. Brilliant. Turning next to Anna Mikolova from the Daily Telegraph. Anna, hi.
Hi, Chancellor. Many businesses have said they'll struggle to stay afloat with a 2-metre distancing rule in place, in particular in hospitality. This week, the Prime Minister suggested he would like to see the 2-metre rule reduced. Would you like to see it reduced?
Well, I agree with the Prime Minister, and I think what he said was we would keep it under review, as we do all of the health restrictions and measures that we've put in place to help tackle the virus. Of course, like anything else, we talk about these things with our scientific colleagues. We understand the risks are involved, and if there are reasons that are sound for adjusting things as we go, as we have progressively made other changes to our restrictions, of course, we'll consider that. But we're not there at this point, and as the Prime Minister said, we keep everything under review. Steve, I don't know if you...
Well, I think Sir Patrick Vallance, the Chief Scientific Advisor, gave a very good description of some of the science and some of the things around the 2-metre rule yesterday. It's not an absolute. 2 metres is not absolute. There's an increasing amount of risk. The closer you are to an individual, and of course, the longer you are close to somebody. That's the basis, for instance, for the contact tracing in test and trace. And there are a number of other mitigations that can be taken around that 2-metre rule. I don't think the scientific evidence has changed, and the scientific evidence will continue to be presented to the government. And of course, if new evidence becomes available at any time, of course, that must be taken into account. But I don't think the science has fundamentally changed.
Anna, anything else?
Yeah. Well, just circling back to your the tax question earlier, you said you don't want to comment on future budgets, which is understandable, but the Prime Minister this week, in answer to that question, reaffirmed that he would maintain the commitment to all Tory manifesto pledges, which include the triple tax lock. Will you also now reaffirm that you will not get rid of that manifesto commitment?
I say, as always, Anna, I agree with the Prime Minister, and would go back to what I said before. I'm not going to write future budgets today. Brilliant. James Tapsfield next from the Mail Online.
Thank you, Chancellor. So far, the public sector has escaped the furloughing, wage cuts and the wave of redundancies in the private sector. Everyone will want to protect the NHS and frontline workers who protect us during the crisis. But is it really going to be possible to shield the wider public sector from the economic fallout that we face? And Professor Powis, do you think there's a safe way to share a barbecue or should we perhaps all be looking more to picnics over the coming weeks?
Thanks, James. Our public sector workers have done an amazing job, many of them on the front line, obviously in the NHS, but also in local councils up and down the country, helping us respond. And now school teachers will also be, over the last few weeks, have been making changes and getting ready to work in a new way to welcome young children back to school, which is fantastic. And they all deserve our praise and thanks. I think if you were asking if I understood rightly about future pay and the situation for public sector workers, I mean, many people in the public sector are in the middle of multi-year pay deals. For example, nurses for the Agenda for Change deal is in the midst of it. And many last year, you remember we had, I think, an inflation busting pay rise for about 1 million public sector workers. There's a process that happens. There are pay review bodies that provide advice to the government, collect evidence, and that process will be underway as normal, and that would be the mechanism through which those decisions are made later on this year.
Well, I think if you're in a garden, a private garden, having a barbecue, whether you're in a park, the fundamental rules around safety remain, which is the 2-metre rule, is to stay distant from each other at all times, to maintain hand hygiene, to ensure your hands are clean, you're washing your hands frequently. So I think it's those general principles around safety and reducing the risk of transmission, which need to be applied in any setting as those lockdown measures begin to be relaxed and more individuals can get together, maintain social distancing, maintain hand hygiene.
Brilliant. Anything else, James?
If I may, Chancellor,
Of course.
I was just wondering whether you considered whether it would be appropriate for ministers to take a pay cut in solidarity with a lot of workers who are facing the same as has happened in places like New Zealand.
Oh, I wasn't aware of that happening in New Zealand, but thanks for letting me know. Again, I with all public sector pay, there's probably a process for that as well, which of course we'll look into. So thanks for flagging that to me. Next and finally, Nathan Stanley from Hull Daily Mail.
Yes, thank you, Chancellor, and good afternoon. The first part of my question is for Professor Powis. This week, localised data from the Department of Health suggests that Hull still has a high infection rate compared with other parts of the country that perhaps experienced their peaks earlier on in this pandemic. Does that mean that Hull is still susceptible to the virus as these restrictions are lifted across the board? And does it mean that people in Hull are more likely to see local lockdowns imposed? And then secondly, to the Chancellor, Hull has one of the worst unemployment rates in the country. National Holidays has gone bust this week. P&O has said it's going to need millions if it's going to survive this crisis. The caravan industry, which is a huge employer up here, is really struggling. So, A, what is your message to people in Hull who are struggling during this crisis? And B, the billions that you sort of spoke about today, I know Faisal from the BBC asked about the cost of these schemes. They're sort of a fraction of the 500 billion that was thrown at banks that were responsible for the 2008 crisis. So can this Tory government pledge to support the workers that it's been protecting throughout after the months and years after these schemes elapse?
Thanks. And I think why don't I go first? I mean, in terms of specific support to Hull businesses, like businesses up and down the country, many businesses in Hull would have received holidays for their business rates for the entire year, cancellation of business rates. You talked about the tourism industry there and caravans. So that industry has particularly benefited from a complete cancellation of its business rates. I think around probably 4,000 or so businesses in Hull would have received a direct cash grant from the government of £10,000 or £25,000 if they're smaller or businesses in the most affected industries like hospitality and leisure. And of course, they have access to all the discounted loans and other things that we've done. I think a broader point I would say is just going back to what I said earlier about our ambitions for net zero. In the budget, I outlined a range of investments in our regions up and down the country over the next few years. And a place like Hull would be a beneficiary of that. We talked about carbon capture and storage in an earlier answer, and obviously the region around Hull has seen amazing growth in offshore wind production, and carbon capture and storage again is something that could be a growth industry for a place like Hull. So I actually think there are lots of opportunities that this government will provide for everyone living in Hull and the region to participate in future growth. And with regard to standing behind workers, I think absolutely that's what this government has done. The furlough scheme, which we've talked about today in particular, was perhaps the most strongest expression of our values as a government and our desire to stand behind those working in this country who, through no fault of their own, have faced a very difficult time over the last few months. That's why we put this extraordinary and unprecedented intervention into place, to do exactly that, to stand behind Britain's workers.
And on local infection rates, Nathan, I think you're quite right. There will be variation in the amount of infection around different parts of the country. That's not unusual in an infectious disease. For instance, in the flu season, which we have every winter, we see variation in the amount of flu in different parts of the country as we go through the winter months. I think the second important point, though, is that our estimate of the R number across all regions in England and parts of the UK is that it is below 1, which means that although there might be some difference in underlying infection rates, the trend is downwards in all parts of the country. And then on the point about whether there might need to be local lockdowns or restrictions, I think what we might find as we continue to see a reduction in the amount of infection is much more localised outbreaks. And we know that we can see outbreaks in infectious diseases, and this in one sense is no different in areas where people are living closer together, so dormitories, for example, prisons might be another that we've talked about, and I think that will require local intervention, local public health intervention to manage those localised outbreaks. And in an earlier question, we talked about the Joint Biosecurity Centre, so the JBC and Public Health England. One of their key things will be to ensure that we detect those outbreaks, localised outbreaks, very early, and the appropriate interventions are made to ensure that the transmission between individuals is broken and the outbreaks dissipate before they can become a wider problem within the community.
Brilliant. Thank you, Nathan. I think that brings us to the end of today's press conference. So thanks, Professor Powis, for all your time, and thank you everyone at home for your time, and thank you as ever for going through us together with this, all of us together through what is a very difficult time. But as we are seeing progressively week by week, things are improving. We are able to lift restrictions, and bit by bit we can try and get our lives back to a new normal. But it is a new normal that I believe is filled with opportunity for all of us. We've talked today a little bit about the economy, and as I said, today a new national collective effort begins. We can start to reopen our country and kickstart our economy, get our lives back to normal, and it's something that we will do all together. Thank you very much. Have a good weekend.